Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.
It's a milestone that hit hard. 1 million Americans lost to COVID-19. And this shocking toll comes after 2 years of isolation, closed schools, watching friends and relatives get sick, and feeling helpless. It's been a rough ride. As more people got vaccinated, case counts declined. Most stopped wearing masks, offices filled with workers, and schools reopened. Then a variant struck, and then another. And another. Cases are rising again, but this time they appear to be milder. But will they stay that way? This roller coaster of a pandemic has many asking, what's next? We'll speak to some of the top experts in the country to help us understand where we are and where we are headed on COVID Now, the facts.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome, everyone, to COVID Now, the Facts. I'm Olga Villaverde. After 2.5 years of living with the virus, we have all learned a lot. But with COVID cases increasing, it can be hard to find reliable information. So in the next hour, we hope to shed some light and help you understand where we are today. My co-host is Dr. Michael Zinner. He is the CEO and Executive Medical Director for the Miami Cancer Institute.
Thanks, Olga. It's been more than 2 years since this pandemic started. Back in early 2020, we didn't know what to expect. But no one would have predicted that 1 million of our neighbors would have lost their lives to COVID. Nor would we have thought that our health system would be repeatedly stretched to the limit. And now a new warning. Cases are surging once again in the United States. Many of us hoped we were done. I certainly was. But as recent hospitalizations increased, voluntary masks are coming back at work and in some schools, and people are lining up to get the latest boosters. Are we, in fact, facing another COVID wave? Milder, perhaps, maybe less deadly, but it's still the same virus that created a worldwide pandemic, worsened a global mental health crisis, and forever changed countless lives. Every day, we find out a little bit more about the virus. We still have a lot to learn, but there are new drugs and treatments available, and vaccines that better protect against variants. We are clearly making progress, but getting the correct message out to the public is still a significant problem. As healthcare providers, our mission is to help you understand what the facts are and how to navigate through the confusion. And that's why we're here, to bring you COVID Now, the facts.
We also have another virus to talk about, monkeypox. We're going to hear more about that a little bit later. But first, we want to introduce our amazing panel to help us lay out the facts. Dr. Kelli Tice is the Chief Health Equity Officer at GuideWell. Welcome, Dr. Tice. Dr. Carlos Del Rio is the Associate Dean of Emory University School of Medicine and Grady Health System. Welcome. And Dr. Kavita Patel is a primary care physician based in Washington, D.C. Welcome, Dr. Patel.
We also have Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Earlier today, I asked him about the recent surge, and here's what he had to say.
People who've been vaccinated and boosted are still having infections because the protection against infection, particularly if people don't wear masks in congregate settings, we're seeing a lot of infections. But the ratio of severity in the form of hospitalizations and deaths to the number of cases is much lower proportionately than what we saw with Delta. We still have a problem that we need to address. We've got to get more people vaccinated, and we got to get those people who have been vaccinated to get their booster shots, because when you're dealing with Omicron, you really do need that booster shot.
And you know, Dr. Zinner, it's really tough to get a handle on this surge partly because people think if they've been vaccinated and boosted, they say, well, I'm immune.
That's true, Olga. And that's sort of the prevailing thought out there. But we did ask Dr. Fauci, and he addressed this also. Let's take a look.
The immunity to coronaviruses, when you do get either infected or vaccinated, is not a very long-lived protection. It wanes and diminishes. It isn't lifelong like we've seen with other viruses, which means that we're going to have to very likely intermittently boost people with a vaccine that is matched to, or at least protective of, whatever variant is out there.
Dr. Del Rio, let me turn to you. How tough has it been convincing people to get properly boosted?
Thank you, Dr. Zinner, for having me with you. Well, first of all, I think there's a population that clearly wants to get vaccinated, wants to get boosted. There's a group out there that is online first, wanting to get vaccinated. Then there's another group that no matter what you do, they're not going to get vaccinated and boosted. And then there's a group that is, the wait and see in the middle that need to be, convinced, need to be explained. And it's a matter of developing trust. So you really don't have one group of people. It's really multiple groups. And I think that's the challenge, right? Is really how do we talk to different communities, to different individuals? We develop the trust necessary for these vaccines for people to accept vaccination. The problem has been that there's been a lot of mixed messages and a lot of confusion. And I think sometimes what I'm finding nowadays is that people not necessarily have lack of information, they have excess misinformation. And combating this information becomes one of the challenges in trying to get people vaccinated.
Thank you. Workplaces and schools are once again beginning to require masks. And despite hospitalizations being up, there just doesn't seem to be an appetite out there for the restrictions that were in place a year ago. Dr. Patel, I'm curious, how do you tell people how to continue to protect themselves in this environment?
Yeah, it's getting tough, Mike. So the key protection is really, as Dr. Fauci mentioned, is really just taking stock. Are you eligible for a booster? It gets a little more confusing because we actually now have, first and second boosters that people might be eligible for. So that's the first thing. Vaccinating the household, that's kind of the second layer. And then the third, it's really back to basics. We've talked about it for 2 years, but it's wearing a mask, wearing a well-fitting mask. We know that matters. And also just keeping conscious awareness of your hands, hygiene, because you don't want to touch your face if you're not wearing a mask. Also, just another point, travel is becoming a little bit more hectic for people as they go into summer break. So I've been telling people, if it really causes you that much anxiety to be in airports, to be on planes, try to look into alternatives. And it's been interesting to me now, after 2 years of dealing with this, that we're also seeing this kind of variable level of anxiety as masks were lifted off of domestic travel. And as most people in the country are just really don't have any mask requirements whatsoever.
Thank you. Thank you, Dr. Patel. Now, Dr. Tice, let me ask you also to expand on this. You're out in the community. What are you telling people?
Well, I think that the most important thing is as we transition, we have to make sure that everyone understands that the more information that we have, the more opportunity we have to assess our own risk and take actions to protect ourselves and those that we love. And what it means really in a nutshell is you take what was just stated, for instance, about the physical mitigation strategies, right? The wearing of a well-fitting mask, and add to that the fact that you can now make a determination based on what your plans are. For instance, Dr. Patel mentioned travel. If you are planning to see loved ones, if you are planning to interact with someone who is high risk, you can take stock of what risk you put yourself at in terms of exposure prior to, and avail yourselves of the wider spread availability of testing to ensure that you are without disease before you engage in some of the numerous activities that are going on across our communities.
Thank you, Dr. Tice.
Thank you, Dr. Tice. We have questions coming in from our viewers, but we want to remind you that it's not too late to send in your questions. So please email us any questions you may have. There it is right there, to questions@allhealthtv.com. That's questions@allhealthtv.com. So, you know, right before we were hit by this COVID latest surge, we heard the shocking announcement that 1 million Americans have lost their lives to COVID. The Associated Press did a story recently that's really put this into perspective. Take a look at this graphic. The number of confirmed COVID deaths is roughly equal to the number of Americans who died in both the Civil War and World War II combined. It's equivalent to a 9/11 attack every day for 336 days. And it's like the cities of both Boston and Pittsburgh, both being wiped out. So we wanted to take the pulse of people on the street and hear what some had to say. Take a look.
I was in the dumps when we were still talking about 200 people dying a day. That's just unacceptable.
I mean, yeah, when you just have a steady drop and sometimes it spikes to 2,600, I think, average deaths and 7-day average or whatever it was. And so I wasn't shocked, and unfortunately it's still happening every day, just people dying.
A lot of people were hospitalized and a lot of people did die, so that was scary.
I had to take my wife to an emergency room, and because of a heart condition. And there were over 100 gurneys in the aisles, in the rows, filled with people who had COVID. Incredibly dangerous. And it really brought me to understand how people were taking risks.
It's very disheartening to feel that many people have died and continue to die, and I just don't know when this can end and if it will.
You know, Dr. Zinner, I hear that so much. People saying, when is this going to end?
Well, I think I hear that every single day where I work at the Cancer Institute. You know, the reaction that we heard about 1 million lives and were they surprised. I remember when this started, we couldn't believe we were going to see 100,000 lives lost or 200,000 lives lost. Not any chance we'd ever get to 1 million lives lost.
And we have some other numbers to share with our viewers, but we have a question that just came in from a viewer, Dr. Zinner, and I'd like to take that real quick. This person writes, his name is Bob. My nephew argues that we won't be able to bear children if he gets the RNA shot. How can I help him understand it won't?
Well, it's not at all related, but let me turn to one of our panelists. Let me turn to Dr. Del Rio. Dr. Del Rio, you were involved in some of the development of the vaccines and trials. Why don't you answer that question?
I mean, I think very clearly the answer, Mike, is no. There's no evidence that these vaccines affect fertility, both in men and in women. In fact, there's data showing that. And there's very good evidence. And I would always tell people, my personal experience, I have 2 children of both married, of reproductive age. And I would have never recommended they receive a vaccine if I thought they would affect their fertility, because I wanted to have grandchildren. And so far during the pandemic, you know, I've had 3 grandchildren, about to get a 4th one. So if the vaccines prevented fertility, I would not be a grandparent ×4 during this pandemic. So the answer is personal, and the answer is no, it doesn't affect fertility.
Thank you.
Thank you. God, so good to hear that. Always around, including you being a grandparent. Thank you.
Thank you, Dr. Del Rio. Dr. Tice, I want to turn to you. Many people actually view the COVID pandemic through the lens, of politics, red and blue. I'm sure you've heard of that as well. So how do you as a health provider navigate your way through that?
Well, I tell you, you know, that's one of the gifts of being a health provider is we have the extraordinary opportunity of really focusing on this based on the science. I think the place where it may have gotten the best of us, though, is that as the pandemic developed, many of my clinician colleagues did what we are trained to do, is we put our heads down and we got to work. And many of us weren't afforded the opportunity to really strategize related to the messaging and prepare a sound plan to combat the excess misinformation that was out there. And it outpaced us, frankly. It is a lesson learned for all of us in the clinical community, especially those of us who have a particular focus on ensuring that folks of color have accurate information and the resources necessary to keep themselves safe. But I tell you what, we have cultivated our skill at communicating more effectively, and certainly in partnering with you and with members of the media community have done a much better job as we've progressed in getting the accurate information right to the ears and the hands of the folks who need it.
And that's so important, and that's why we do these town halls here at PBS, Dr. Zinner, because there really seems to be a lot of political ideology in play with this pandemic.
Yes, there is, Olga. And as we all know, there's no such thing as a red vaccine or a blue vaccine. And I had the opportunity to talk to Dr. Fauci about this also. Let's listen to what he has to say.
I wish people would put aside any ideological reason to not get vaccinated and realize that when you look at the data and compare the unvaccinated to people who are vaccinated, and particularly vaccinated and boosted, the hospitalization rate and the death rate is dramatically greater in the undervaccinated or unvaccinated, and among those, particularly elderly and those with underlying conditions. And even some people who have been vaccinated and not boosted are going to wind up getting severe disease.
So let's look at the numbers for vaccines and boosters. Listen to this. More people are fully vaccinated, according to the CDC. 77% have received one dose of the vaccine. 66% have gotten their second dose. 46% are considered fully vaccinated with their first booster shot. And 19% of those 50 and older have gotten their second booster. And I really think it's important, Dr. Zinner, to show these numbers and to talk about them, because clearly, and maybe I'm wrong, but you tell me, more people need to get vaccinated.
There's no question that more people need to get vaccinated. In our hospital situation, the only people that are being hospitalized and the ones that are passing away are those that are unvaccinated and also in the older age group. Let me turn to Dr. Del Rio again. And how do we get the rest of the population vaccinated? And then more importantly, what do we talk about in terms of your recommendations for booster shots?
Well, it's going to be very hard, and we have seen the rate of vaccinations almost not go up at all lately. And I think part of it is because people want this to be over, right? And why do I need to get vaccinated for this to be over? So really, it's going to be primary care providers reminding their patients to get vaccinated. And again, it's going to be about developing trust in the community. And we have lost a lot of things in this pandemic, including the million lives, but we've also lost the trust in public health, and we need to recover that. And that's going to take some time. But the other thing is, when people ask me about a booster, my recommendation is, if you have 3 vaccines, if you have 2 mRNAs and a third one, you are fully vaccinated, you are up to date, and you don't necessarily need a 4th booster, unless you happen to be somebody over the age of CDC says 50. I think it should be probably the age of 60. Or if you are having some immunocompromised condition, in which case a 4th dose is recommended. There's a lot of studies happening right now, Mike, in which we're going to come up with data trying to understand which should be the vaccine that people get in the fall. And probably in the fall, it's going to be recommended that people get another vaccine. The question is it going to be the vaccines we have right now, or is it going to be more of an Omicron-specific or a variant-specific vaccine? Those studies are happening, and we need to wait for the FDA and the ACIP to make a decision. So if you're under the age of 50 and you have received your 3 doses, I'm telling people to wait until the fall and then get the 4th dose. I don't really see a need for them to get that 4th dose right now.
Oh, Dr. Del Rio, thank you very much. That's very helpful and again, consistent with what the CDC is trying to get out. I'm going to turn to a variant of that, though, and turn to Dr. Patel. We've seen the phenomena of parents taking the vaccine for themselves, but hesitating regarding their children. Can you help us understand either what's driving that, or more importantly, how do we get parents to understand the need for their children 5 and above, and pretty soon, hopefully, 5 and below?
Yeah, Mike, it's not unusual to see parents, even enthusiastic parents who were eager to get vaccinated themselves, to have questions. And I know that gets labeled as hesitancy. I describe it a little differently because in talking to parents, they really do feel like they want to see more data. They want to see more time so that they can best understand, is this truly safe? Usually it's a conversation around safety. It's very rarely a conversation around efficacy. You know, this is not 80% or it's not high enough. It's usually around safety. And I think, to be candid, we've had now decades of really poor information or disinformation about a variety of things, including vaccines, that have contributed to some of that hesitancy or skepticism. I think what I try to do is I actually just try to put a placeholder and say to families, all right, ask me any questions you want, just let's go through everything. But then also tell me, what is it that you're looking for that would make you kind of feel comfortable vaccinating your child? And is it time? Is it more and more journal articles? Is it doctors such as myself or any one of us on the panel kind of telling you that our children were vaccinated, if that's the case? In my case, it is. And so all of those things kind of matter. And here's what I'll say now, having done this, I feel like it's dog years. I feel like I've been doing it for 7 years, but since we've had vaccines, it's only been about a year plus, and even less for children. I feel like what it takes is more than one touch, because it's not something that I can do in a 15-minute transaction, you know, in a busy, crowded clinic when there's a number of other things to discuss. So usually I'll start the conversation, and then like clockwork, they'll have to come in for either other follow-up visits for their own care, and then we can deal with the subject again. And I also try to recruit family members, because more influential than me in 15 minutes that you see every so many months are family and friends. So I encourage parents, have you talked to any of your friends? And then they'll usually tell me, yes, and we've heard about this, this, and this, which most of the time are either just, you know, misinterpretations or myths about the vaccine, as we've been talking about. And then when you start to also show the data that we now have around hospitalizations and the risk for children who are not vaccinated for hospitalizations and for some of the things that I'm protecting my kids against, like long COVID, as well as, honestly, just being out of school. Our kids have been out of school for so long that even those 5 days plus is just time they don't need to be out of school. So we try to use this as a way, but it doesn't happen quickly. And as time goes on, it'll be interesting to see the under 6 population, Mike. I think it'll also have kind of a low uptake for some of the same reasons, and I hope we can overcome that.
Thank you, Kavita. I'm going to move on to Dr. Tice and ask your thoughts on the very same question. But Dr. Tice, I'm going to add another part to that. And I wonder if you can help us put a pin in the falsehood that somehow vaccines are related to autism. That's been dispelled. We've got to help get rid of that conspiracy theory.
Absolutely. You know, I mentioned in my last response that one of the challenges for us as physicians is that we have not had a strategic messaging plan. And that falsehood about autism with an invalid study that was, you know, debunked time after time after time is one that we need to carry forward. No parent wants to get this wrong. No parent wants to get this wrong. And understanding that, we have an opportunity to connect through our relationship with our patients and have them feel heard, seen, understood, and give them an opportunity to voice for themselves, just as Dr. Patel said, what their concerns are. And in that dialogue, we can address real concerns. Too often, though, the constraints of a visit limit that interaction such that folks are going to Dr. Google rather than using their physician as a good resource.
That's right, Dr. Tice. And actually, speaking of real concerns, in the beginning of this pandemic, there was a lot of hesitancy in underserved communities about trusting the government and the vaccines. One reason for that was the Tuskegee syphilis study back in 1932 by the U.S. Public Health Service. The men enlisted in the study never received any treatment even after penicillin was discovered. So the Ad Council released a series of public service announcements to help counter that distrust of the government. Take a look at this.
My grandfather was part of the study, Elliot Ware, and Frank Cooper. Just get educated about what went on with the study.
It's just amazing how people still don't know. And now they're comparing it to the COVID-19. It's not a comparison.
Due to the fact that they wasn't given treatments, things have changed now. I've been a nurse since 1981. I just started wanting to do something to give back. You know, after I found out what happened to my great-grandfathers.
And I made the decision that I was going to get the shot. That's the reason I'm doing it. I'm doing it for them. I'm doing it for myself. I'm doing it for my kids.
We love you so much. Yes.
Dr. Zinner, that family made a very strong point that there's no connection between what happened in Tuskegee and the COVID vaccine.
Yeah, Olga, that was an embarrassing tragedy that occurred in probably the worst times of our public health experience in this country. And we'd hoped that we had dispelled that rumor completely, that there was anything related to what we're doing now. That was an experiment. This is a treatment. This is something that's very important. Dr. Tice, let me turn to you. Do you still hear about hesitancy about patients in the population getting vaccinated or boosted?
I do. You know, while I may not specifically hear about concerns related to the Tuskegee study, I certainly do hear often that there is not a trust of the vaccine. And that comes from a few places, you know, one of which is the fact that these things are difficult to understand, right? You know, particularly early in the pandemic, information was changing so rapidly that often our guidance was changing just as rapidly, which made it difficult. The other thing that occurs is that the Tuskegee syphilis experiment was not isolated in terms of experiences that populations of color have had in the medical system. Bias exists, medical racism is a thing. And because it's true, failing to start there in terms of acknowledging what the experience of many people of color has been in the medical system really perpetuates that mistrust. Finally, I think an important opportunity was realized, and those of us, physicians of color, who were watching this evolve, as it were, and as the initial data began.
We're having some issues with Dr. Tice's connection. Hopefully we can fix that and get her back on. While we're fixing that, because obviously technology is what it is today, we have a viewer question, and I want to get to that. And it's a really good viewer question, Dr. Zinner. This person asks, I've had one booster shot, but I worry about getting too many shots in a short period of time. The vaccines may be safe, but they're new, and we don't know if there will be any long-term effects. You know, Dr. Zinner, you and I have spoken at length about this. Many people come up to me saying that they're concerned about the long-term, worried about getting too many doses of the vaccine. Your thoughts?
So we got to keep a lot of things in mind, but one thing we have to keep in mind is that the protectiveness of the vaccine wanes over time. We said that at the beginning. So it goes down over time. So it's appropriate to get a booster. And it's appropriate perhaps every 6 months to get something like that. As Dr. Del Rio mentioned, we're probably going to see something again in the fall. I can tell you that every member of my family, if given the opportunity, would probably get a booster every 6 months. And speaking of Dr. Del Rio, let me turn again to you, Dr. Del Rio. You've been involved in this with the vaccine development. What are your thoughts on that? Are there too many boosters that we're getting right now? Do we have to worry about that?
Well, first of all, Mike, I think we need to remind people that what these vaccines were designed to do. These vaccines were designed to do is to prevent hospitalization and death. They are not, they're effective, but they're not great at preventing infection. Because in fact, getting a vaccine, that sterilizing vaccine for a respiratory virus, it's really almost impossible. We know that flu vaccine has an efficacy of 30, 40, 50% at most in preventing infection. So these vaccines decrease your risk of infection, but they don't eliminate it. But they are exceedingly good at decreasing your risk of severe disease, hospitalization, and death. And that's the message we need to get across to people. It's a very complicated message, but the point is, what you want to decrease is your risk of getting critically ill. Getting the vaccine, getting that booster every 6 months or whatever frequency is going to be necessary, it's going to decrease your risk of infection, but it's not going to be as much as you would think so, unfortunately. And in that respect, there is research happening on better vaccines or more effective vaccines, so different ways of delivering the vaccine, like a nasal vaccine, which in fact may become sterilizing vaccines. So the other thing to remind people is that the science is evolving. As the science evolves, we will have better vaccines. I've seen that myself, for example, in HIV. The medications we had to treat HIV in 1985, 86 are not the medications we use today. The science has advanced and we have different therapies. The same thing is going to happen with vaccines and for treatments and on treatments for COVID. So we also need to let the science evolve and need to let the science inform the decision-making process. Because the reality is, when you have a new disease like this, we don't have all the information. And one of the things we need to learn to tell people is this is what we know today, this is what we're studying, and this is what we will know in the future, and we will tell you about it when we know it. But we don't have all the answers right now.
Thank you, Dr. Del Rio. I appreciate that. Dr. Zinner, I have another question from a viewer, and this is what they write. I have a friend who's had COVID twice, once in the beginning of the pandemic and another case about 5 months ago. And you've heard about that as well with some of your patients. She hasn't gotten a vaccine because she says she has the antibodies. This viewer wants to know what's more effective, having the antibodies or a vaccine. What are your thoughts, Dr. Zinner?
Well, there is some recent evidence that said getting a vaccine, even if you've had the COVID, does increase your immune response. But let me turn to Dr. Patel on this one. Dr. Patel, do you have any thoughts that you could share with us on this specific issue?
Yeah, sure. A couple of things. Number one, it would be wonderful if I had a really quick way, kind of do a finger prick and tell that this amount of antibodies from your previous infections translates to this amount of protective immunity. I would love to go into my time machine and figure out a way to do that for the future, but I'm in the here and now and I have to kind of deal with the information. We just simply do not know what level of immunity from your infection translates to protection like we do with vaccines because of clinical trials. And then furthermore, we know, by the way, I've had patients that have been very rare, but have been infected almost in every surge because of different variants. And that gets to my other point that we know that with the vaccine, that we're not just targeting, we're basically kind of priming the immune system to be able to react and respond to different variants like we've seen with Omicron, like we've seen with Delta, like we've seen with other variants, including the original Wuhan strain. So that really adds up to really recommending, as we all do, for anybody who had an infection, they should space out from the time of infection to the vaccine. We generally don't want them to get the vaccine right after an infection, but besides that, we definitely think that somehow probably the best immunity is that combination, some of the immunity from the vaccine as well as some of the immunity from an infection-induced immunity. So I'm not encouraging people to go get infected, but I'm just saying that adding the vaccine on top of your 2 infections actually will protect you more, and it's not going to harm you. I think that's critical. I've had a lot of patients ask, is it too much? Is this just too much in my body? And I'll say this again, because I think we've had to talk about this before, Mike, but I will say this again, the vaccine does not leave a trace in your body. Think of it, it's called messenger RNA because it delivers a message to your body, and then like a messenger, it goes away. And so there is not a remnant of anything but what your body produces in terms of antibodies that would naturally happen and also be provoked by that shot. So net, I'm sorry you got infected twice, but please go get your vaccine. It can be incredibly helpful as we're dealing with the current surge and surges to follow.
You know, Olga, just as a follow-up for Dr. Patel, what she was talking about, this messenger RNA, the messenger RNA is right, doesn't leave a trace in your body. It kind of tricks the body into thinking it had COVID so it can develop the antibodies and the immunity to it. So it's not like it's going to hang around or do anything bad. And it's an addition to the immunity that you might get from the infection itself.
And I'm so glad you both pointed that out because it's so important to get that information. Speaking of vaccines and boosters, Dr. Zinner, those are 2 ways, but there are also medications out there that work against COVID, and I want to talk about that with our viewers.
You know, that's right, Olga. And there are a number of oral medications that have come online now. One of them is named Paxlovid. And I had the opportunity to talk to Dr. Fauci about the new medications that are online for treating the disease, not just preventing it with vaccines. And let's hear what Dr. Fauci has to say.
There's also a preventive monoclonal antibody to be given to those people, particularly who are immune compromised, who do not make a good immune response against the vaccine. And it's called Evusheld. And that's an available monoclonal antibody for prevention. But the drug that we're encouraging people, including physicians and healthcare providers, to utilize more of is a drug called Paxlovid, which is a drug that's made by Pfizer, which has the capability of preventing people from progressing to hospitalization by 90%, 89 to 90%. And it is specifically used for people who are elderly and those with underlying conditions. It is being underutilized, and we're now trying to get people throughout the country to realize that there are these drugs available in tens of thousands of pharmacies throughout the country. People who are infected and get Paxlovid, they get immediate improvement in symptoms, and their antigen test turns negative. And in some small percentage of people, they wind up a few days later, after they finish the Paxlovid, to have an increase in symptoms which are usually mild and a return of positivity of the antigen test. But thus far, we don't see them going on to severe disease. And we're trying to figure out what the reason for that is. We don't know enough about it to make any definitive statement, but we want to emphasize that is not a reason for people to withhold taking Paxlovid, because it can be life-saving.
And also, Dr. Zinner, in that interview, Dr. Fauci talked about a program, a really good program that's currently in thousands of pharmacies. It's called Test and Treat.
This is an important program because it moves the treatment and testing out into the community where most of us live. And that's a dramatic increase from what we've had before. Again, for patients particularly who are immunocompromised or elderly, not having to travel to a center, but going to their CVS or their Walgreens is very helpful. Let's hear again what Dr. Fauci has to say about this.
There's a new program called Test and Treat, which means you can go into any one of 2,000 to 2,400 pharmacies or health clinics that have the capability of testing you and immediately getting that Paxlovid to you, because it can be life-saving for people, particularly those who are vulnerable because of either underlying conditions, immune compromise, or elderly. And just like you mentioned, if you look at the profile of people who are hospitalized, whether they're in Florida or any other place, it's heavily weighted to the unvaccinated and for those who have underlying conditions and for those who are elderly. And the more elderly you are, the greater the risk.
So Dr. Tice, we're seeing that in our own center where the highest vulnerability is in the obviously unvaccinated, but even some of the vaccinated over the age of 65 and 70. We've just heard about Paxlovid, this oral agent which is to be used when patients turn positive. But there are also some warnings associated with Paxlovid. There are some drug interactions. Can you share that with the audience about what some of those concerns are?
Well, certainly the concern has to do with those that are being managed for things like liver disease or kidney disease. And it's one of the challenges. When we talk about delivering treatments in an equitable fashion, one of the challenges with that, of course, is ensuring folks have access to the right information. So we certainly point people back to their physicians and ask that they, one, because they are aware that this treatment exists and it has the potential to be life-saving, that they engage their physician, especially if they have multiple chronic conditions, to get the green light, as it were. And in fact, that they not decide that it's not for them without having a conversation with their physician of record, which often happens. Folks feel like, they're not too ill. Their symptoms are mild, and they misunderstand the probability, the likelihood that their symptoms will progress and they may get into trouble.
So, thank you, Dr. Tice. So one of the things we know about Paxlovid is it does begin to interfere with, as you said, both liver function and sometimes kidney function. So what we recommend is that patients who are on any medications like cardiovascular medications, check with their physicians before they engage with that, because you may have to alter the dose. Olga?
Great stuff. Thank you, Dr. Zinner. As more people were vaccinated, more couples actually decided to start and add to their families. There was a slight increase in the number of babies born in 2021. Here are some facts about COVID and pregnancy. Take a look at this. Pregnant women are more likely to get very sick with COVID. They have an increased risk of complications that can affect the pregnancy or the baby. Getting vaccinated during pregnancy reduces the risk of infection and severe illness. We actually spoke with a mother-to-be who was vaccinated and she still got COVID. Here's her story.
I am 6 months pregnant. I'm having a little girl due in September. This is my first pregnancy, and I just had COVID about 2 weeks ago. My fear just kind of tripled, quadrupled, being pregnant and now having COVID. Where I feel like I don't have the answers that I need is more in this post-COVID recovery. Do I have antibodies now, and how long will I have antibodies? I'm due in September. So will my baby have antibodies? I've asked 2 different doctors, and the results are kind of all over the place. Some say maybe, some say no, some say it's too hard to tell, we don't have enough data. But, of course, that's in the back of my mind that, what can I get in a couple of weeks from now? I've heard that you can have rebound symptoms. There's just so much, I don't want to call it gossip, but there are so many things that are being said out there that you don't really know what to take as gospel and what's made up and what's real.
So, I want to pose this question possibly to Dr. Patel regarding women who are mothers-to-be, because it's a frightening moment for them.
Yes, and we need to know, Dr. Patel, what women would possibly do if they're not able to take the COVID vaccine.
Yeah, so really important, I think, is that not only the American College of Obstetrics and Gynecology, but the Society for Maternal Fetal Medicine, a number of advanced gynecological kind of reproductive assistance societies have all weighed in that they recommend vaccination for pregnant women or those intending to become pregnant, just to dispel, I think, again, some of the myths that it can affect fertility, which is a very valid concern, but still something that we have no evidence of. And quite the contrary, as you just heard, we've got mothers who are vaccinated and infected. Just a case in point, in April of this year, in the Journal of the American Medical Association, some former colleagues of mine actually published research on this. We don't conduct studies purposefully on pregnant women. There were some pregnant women in the vaccine trials that became pregnant, but it was not something that was included as part of a purposeful way to measure this. And so what we learned from about 2,000 patients that they looked at, that during 3 phases, before Delta, surge before Delta, the Delta surge, and the Omicron surge, is that there were more pregnant women who were likely to be infected during the Omicron surge. In fact, 10 times higher the case rate, but that the hospitalization was much lower, and that's attributed to vaccination. So in short, even though as a pregnant person, I would feel very nervous getting COVID, your vaccination does protect you from that severe illness. And to the question about antibodies to the baby, it does depend. Again, this gets back to when your vaccine was administered, before your pregnancy or during your pregnancy, and then also when was your infection during your pregnancy. So some people kind of later towards birth might have antibodies and some might not, depending on the timing. And then I think just, Mike, to your point, and Olga, like, what could you do if you had a contraindication, a reason to not get vaccinated? And by the way, just going through those reasons, working with allergists and working with immunologists, there are very few people that fall into that category. But if you do fall into that category, I think this is where we get into just the common sense things we've been talking about, masks, et cetera, being very careful of who you're around. But then on top of that, I just want to point out that the treatments that we've talked about, Paxlovid, as well as another monoclonal antibody that wasn't mentioned by Dr. Fauci because it's used as a treatment. There's really only one that works right now against Omicron, and that is also something that we can use. Again, those are treatments in case you are unfortunately diagnosed or have a positive case. But outside of that, the protections that we have are the ones that we have been taking even before we had vaccines. But I just want to put in one more. I know people are watching, and I have colleagues who have been counseling. I want people to remember that it's safe in pregnancy, it's recommended in pregnancy, and it will not affect your fertility. And in fact, the birth outcomes of vaccinated women are better than unvaccinated pregnant mothers who caught COVID.
So appreciate your answer, Dr. Patel, really do. So when we took our cameras out on the street, we also asked people how certain they are about the future and what they see as normal going forward. Remember that word, normal? Let's take a listen.
This is the new normal. We're never going back to normal. There's just too much stuff out here right now. And then there's too many people that are not taking heed to it and protecting themselves and protecting others.
You know, I think it's very similar to the flu shot. You know, we get the flu shot every year. We get, other vaccines. So I think it's just nothing different than any of that.
I think this is the new norm. I think this is the new norm. You know what I mean? We're going to continually evolve into different types of, I wouldn't say I hope we don't go through another pandemic, but yes, this is the new norm.
Sad to say, I don't know what the end will be. It's too many people that's fighting against it. I really feel like if we had all come together better in the very beginning, that we would be much farther along. But unfortunately, we did not, and it's a day-by-day situation.
Eventually, it's going to get to the point where people just get sick during the year. And, oh, what'd you get sick from? Oh, it was a cold. Oh, it was COVID. And no one will care which way it went.
I hope things will be more normal one day. But normal for us would mean not so many deaths, right? And not just living life however we feel like it. So I don't know. Right now I feel not very optimistic, but I hope so. I hope over time, and possibly with more boosters, I actually think that could be part of what helps us get back to normal.
I would like to see us get back to normal. I would like to see that happen within the next year or two.
Oh my goodness, I'm hoping it's sooner than that. We asked Dr. Fauci his thoughts on normal. We're also going to hear from the panel in just a moment. Dr. Zinner.
That's right. But right now, I just want to turn our attention to another outbreak that's in the news and has people concerned, and that's monkeypox.
The rare virus is usually found in West Africa, but the World Health Organization has confirmed cases in over 16 countries so far. Now, monkeypox is in the same family as smallpox, and it's spread through close person-to-person contact, but you can also catch it through respiratory droplets. The telltale signs are painful lesions that can form throughout the body. Now, while monkeypox can be fatal, most people recover in a couple of weeks. Dr. Zinner.
And we hear that. Dr. Del Rio, where the heck did monkeypox come from, and why are we talking about it?
So monkeypox is a virus of the same family of the smallpox virus, and it's sort of a milder form of smallpox. And it lived in animals in Africa, and there's probably 2 different clades of it. And we have seen, Nigeria and many other countries in Africa have continuous outbreaks of this disease. Especially these outbreaks have occurred more and more commonly after we stopped smallpox vaccination once the disease was eradicated. But what we have seen is that occasionally disease gets exported from those countries to non-endemic countries like the US, Canada, Europe, etc. And if you see in the US 1 case, you've seen too many cases. You shouldn't see cases of monkeypox. In 2003, we had a very large outbreak in our country where prairie dogs were infected with monkeypox, and they were infected when they brought a shipment of Gambian rats and they put them in the pet store together. And out of that infection with prairie dogs, a total of 47 people became infected across 6 states. But the outbreak was contained, and that was the end of that. This outbreak this time around is a little bit different, and it's a little bit different because it's, as Olga mentioned, it has already gone to multiple countries across the world, and it's primarily right now affecting men who have sex with men. But that doesn't mean that it's a disease of men who have sex with men. It can affect almost anybody that has been exposed to it. And now there are a couple of big differences. People are very concerned about it, but the reality is this is a disease that we understand very well. We know what vaccines work. We know how to contain it. So public health in action should be able to control this disease. At the end of it, what we're going to need to do is information, identification, and isolation, and talking to clinicians and training clinicians to be aware of these lesions, to know to recognize them, and to rapidly, do the contact tracing necessary will allow us to stop this infection. So yes, this is what happens when we travel places. This is what happens when we have an interconnected world. What happens in Africa is important to us. What happens in China is important to us. And I think one of the least lessons out of this pandemic is the importance of global health. We cannot be isolated. We cannot just depend on, I care about my community, I don't care about anybody else in the world, because the reality is, if we try to improve global health, it's good for all of us.
Thank you so much, Dr. Del Rio. So we're nearing the end of this amazing town hall, Dr. Zinner, and many people continue to ask when this will end. Will we ever go back to the way it was before COVID? That's the big question.
As we mentioned, we get asked that question all the time, and I had the opportunity to ask Dr. Fauci just that question, and here's what he had to say.
We have boosters, we have antivirals that you just mentioned a moment ago, and we have tests to tell if someone is infected, so therefore they can prevent themselves from spreading it to other people. Those are the things we have, and if we implement them well, we can move on, not exactly the way we were before COVID, but very much approximating what we call normality.
Normality, what we all want. I'd like to hear from all of our experts on this as well. Let's start with Dr. Tice.
Yes, thank you. You know, anyone who knows me knows that I am a glasses half full kind of woman. And certainly for me, normalcy is being able to do the things that you enjoy doing, be with folks that you love, and having enough information, resources, and tools to keep yourself safe. Whatever that looks like, I am happy to define that as our new normal, and let's get on with it.
Dr. Patel, your thoughts.
Yeah, so I'll just start by putting it into historical context. I've become a history buff as of late, but studying a little bit about what's happened in previous pandemics. And I'll just say that if I mentioned bubonic plague, smallpox, and Spanish flu, most of us have no memory of that, or at least what memory some might have is so distant that it's hard to imagine. But those were three incredible threats in different parts of time over the globe that really changed population structure, economies, and just like we've seen with COVID right now, kind of changed the way life was conducted. But out of those came incredible, as I do believe with COVID, that this kind of new normal, out of that came incredible progress in disease eradication, surveillance, public health. I would just say that having this conversation about mRNA vaccines, messenger RNA vaccines, and the ability for the world to focus like that is now something that I think will truly be beneficial, not just for COVID, but for so many diseases. mRNA is not new technology, but had a lot of reasons that we weren't able to all concentrate our research dollars, effort, and energy, but we can. So I think for me, what's exciting as a physician and somebody who tries to understand how to help people kind of move through this, number one, we're all grieving. We all kind of miss the way, quote, life used to be, but I want people to kind of use it as a way to shift their thinking. And then now, Mike and Olga, we're seeing incredible cures for cancer. We're seeing progress made for an HIV vaccine. We're seeing things that I could never have dreamed. And I would never want the deaths that we had to be the price we pay. But for me, moving forward, it's something that I carry with me so that we know, just like the other three plagues and kind of three pandemics that I mentioned, that we move out of it for the better as a world.
Dr. Del Rio, your final thoughts, please.
Well, I would just say that, following up on Dr. Patel, all pandemics end, but there's no event, there's no a moment where somebody stands up and says, okay, this is over. It goes a little bit like the waters recede, right? At some point in time, we adapt to a new normal, we adapt to a new reality. And what I like to tell people is I don't want to go back to the way things were. I want to go forward to a better world. I want to go forward to a world that has better information. I want to go forward to a world where we have less health inequity. I think one thing that this pandemic has taught us is the enormous cost of health inequity. One of my heroes, Bill Foege, says something that has a quote that I really enjoy. He says that, from Dolly Parton, says, "You have no expensive how it is to look this cheap." You know, we have been cheap in public health. And as a result of that, we're paying a lot of money today dealing with this pandemic. So I want us also to understand the importance of building a better health infrastructure in our country, a better public health, giving access to healthcare to people. If we create health equity coming out of this pandemic, we may be in a better place and we may be better protected for a future pandemic to come.
Thank you so much, Dr. Del Rio, Dr. Patel, and Dr. Tice. We so appreciate your time during this town hall.
I want to thank you also. And let me just make a couple of closing comments. We've come a long way. We're nowhere where we were 2 years ago. We need people to remember to get vaccinated. We need them to get boosted. And remember to be responsible so that we can all get through this and get as close back to normal as we can. Olga.
Thank you, Dr. Zinner. I want to thank our viewers and our panel for being with us. We hope we've clarified some of the uncertainty surrounding where we stand with COVID now and what we can expect in the future. And Dr. Zinner, we only have about 45 seconds left, but I want to thank you for your time as well. I think this has been a very informative town hall that we continue to bring on behalf of all of you out there and on behalf of all of us here at PBS.
Olga, again, it was my pleasure. It was also a pleasure to have us some of the panelists we've had in the past. I expect this won't be the last time we address this audience, and I look forward to that in the future.
And we look forward to hopefully one day getting back to some sense of normalcy, Dr. Zinner, and moving forward and using these times to remember, learn, and move ahead. We thank you so much for joining us. Please stay safe. We'll see you next time. And again, thanks for joining us.
Thank you.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.